I'm Dr. David Barold, and on this channel we cover ECG basics and how to avoid common diagnostic ECG errors. This is part one of a three-part series on atrioventricular block, where you will learn the following. 1. What is first-degree atrioventricular block? 2. What is third-degree atrioventricular block? And 3. What is AV dissociation? Atrioventricular or AV blocks are caused by disturbed conduction of the cardiac impulse from the atria to the ventricles. The conduction disturbance can vary from a mild delay to a complete conduction block. There are 3 different degrees of AV block: first degree, second degree or partial block, and third degree or complete heart block. This video will only cover first and third degree AV block. Second degree AV block is covered in part 2 of this video series. When a cardiac impulse is conducted normally from the atria to the ventricles, a QRS complex follows each P wave in a 1-to-1 ratio, and the PR interval is between 0.12 and 0.21 seconds. The PR interval is measured from the onset of the P wave to the onset of the QRS complex. In first-degree AV block, the PR interval is greater than 0.21 seconds. In this example, the PR interval is approximately 6 small boxes wide, which equates to 0.24 seconds. In first-degree AV block, there is a delay and not a true block. The term first-degree AV block is a misnomer, but it is here to stay by convention. If the delay is marked, the P wave may be hidden in the preceding T wave. With first-degree AV block, the delay often occurs in the AV node. Now I'm going to talk about third-degree AV block. In third-degree heart block or complete heart block, none of the cardiac impulses from the atria are conducted to the ventricles. The atria and ventricles are activated independently of each other. On the top is the atrial rhythm, and on the bottom is the ventricular rhythm. As you can see, the atrial rate is faster than the ventricular rate. This is what it looks like on the actual ECG. The atrial rate indicated by the blue arrows is 105 to 110 beats per minute, and is faster than the ventricular rate indicated by the red arrows, which is 45 to 50 beats per minute. In complete heart block, the atrial rate is faster than the ventricular rate. This is important. Ignoring this concept can lead to diagnostic errors. In this ECG, the QRS complex is wide, indicating that the ventricular rhythm originates from a site in the ventricle. If the QRS is narrow, it originates from the AV junction, which is the junction between the atria and the ventricles. It is often said that the P waves are marching through the QRS complexes. It is also described as AV dissociation, which is the lack of relationship between atrial and ventricular activity. Complete heart block, where the atrial rate is faster than the ventricular rate, is not the only cause of AV dissociation. AV dissociation can also occur in relatively fast arrhythmias where the ventricular rate is faster than the atrial rate. That's it. Now get ready for the key takeaways. 1. First-degree AV block is a prolonged PR interval greater than 0.21 seconds. 2. First-degree AV block really means delayed conduction from the atria to the ventricles and not a true block. 3. In complete heart block, the P waves do not bear any relationship with the QRS complexes. 4. In complete heart block, the atrial rate is faster than the ventricular rate. And 5. Complete heart block is not the only cause of AV dissociation. Next, be sure to watch part 2 in this series, where you will learn about second-degree AV block. Drop a question or comment below, and be sure to subscribe and click the bell icon to be notified of my next video release.